Lisa and Henry are both psychologists doing research on how to treat anxiety. Lisa wants to see if a new pill is more effective at treating anxiety than the pills that doctors have been using. Henry isn't interested in introducing a new pill to the market. He thinks that adding in a lesson on deep breathing techniques will reduce the symptoms of people who are already taking traditional anti-anxiety drugs. How should Lisa and Henry do their studies? Experimental design is the process of deciding how to implement scientific research. There are many types of experimental design, all of which have advantages and disadvantages. Let's look closer at the strengths and limitations of several different types of experimental designs. Lisa is interested in whether a new pill works better than the old pills at treating anxiety, while Henry wants to know if adding a lesson on breathing techniques to the treatment plan will help treat anxiety. One of the first questions that Lisa and Henry will want to answer is how to divide their subjects into groups. A between-groups design involves having two or more different groups of subjects and giving each one a treatment or no treatment. For example, Lisa might want to divide her subjects into two groups. One group would get the traditional pill used to treat anxiety, while the other would get her new pill. She could then compare how anxious the two groups are to see which pill is better. The main strength of a between-groups design is that it allows a researcher to look at the effects of a treatment in isolation. If Lisa gave both pills to all of her subjects, there's no way she could tell if the improvement was due to one of the pills or the combination of the two pills. Even if she had the subjects take one pill for 1 month and another pill for the next month, the first month of pills could influence the second month. A between-groups design allows her to isolate the effects of both pills. But there are limitations to a between-groups design, too. The main disadvantage is the problem of making sure that the groups are equivalent. For example, what if Lisa ended up with people who are less anxious in the group taking her pill than in the group taking the other pill? Her results might be due to differences in the groups, not due to the pills. The opposite of a between-groups design is a within-groups design, which involves having one group of subjects and comparing their responses to different treatments. Remember Henry? He might want to use a within-groups design to test if his breathing techniques help. He could measure his subjects' anxiety when they are just taking the pills, and then teach them the breathing techniques, and then measure them again. He's essentially comparing them to themselves. Like between-groups design, a within-groups design has both strengths and limitations. One strength of a within-groups design is that there is no question about whether the groups are equivalent or not. You are comparing people to themselves, so they are equivalent. And because you only have one group instead of two or more, a within-groups design requires fewer subjects. The main disadvantage of a within-groups design is that, unlike a between-groups design, it is difficult to isolate treatments from each other. There's always a risk that the treatments are affecting each other. For example, does Henry see an improvement because his breathing techniques work, or because the patients have been taking the anti-anxiety pills for longer? It's hard to say for sure. Besides between and within groups, another way that experimental designs are separated out is by looking at the number of independent variables, or factors, a researcher is looking at. The independent variables are what are, hopefully, making changes in the subjects. Let's go back to Lisa for a moment. She's interested in how her pill compares to the traditional pills. She has one factor, type of medication, that is influencing the dependent variable of anxiety level. Because she only has one factor, she is doing a single-factor design. One advantage of single-factor designs is that they are simple. The simpler a research question, the clearer the results are to analyze. A single-factor design is the simplest of all designs. You have one independent variable and one dependent variable. But the simplicity of a single-factor design is also a weakness. Is real life simple? Usually, no. A single-factor design is simple, which is great for seeing results clearly, but it also leads to the problem of not being able to answer complicated research questions. To answer a complicated research question, you need a factorial design, also called a multiple-factor design, which is a study done with more than one independent variable, or factor. For example, what if Henry decides that he wants to know if the effect of his breathing technique is different when paired with Lisa's pills versus the traditional pill? Henry is looking at two factors, breathing technique and medication, so he is doing a factorial design. The strength of a factorial design, as we've already seen, is that it can answer more complicated research questions than single-factor designs. But that's also its weakness. The more factors you are looking at, the more complicated the results get. At a certain point, it becomes difficult to discern which factors are most important, which can lead to fuzzy results. Because all experimental designs have advantages and disadvantages, researchers have to make decisions. There is no perfect experimental design, so understanding the strengths and weaknesses of each allows a researcher to choose the design that's best for their particular study. Experimental design is the process whereby a researcher decides how to run their study. There are advantages and disadvantages to all types of experimental design. A between-groups design allows researchers to see effects without worrying about treatments influencing each other, but can be problematic if the groups are not equivalent. A within-groups design guarantees equivalent groups, but runs the risk that one treatment will impact the results of future treatments. A single-factor design offers simple, clear results, but can only answer simple research questions, whereas a factorial design can answer complicated research questions, but doesn't offer simple and clear results.